Welcome to Public Health Matters, where we talk about matters in public health. I'm Jane Goodman, Public Health Network Strategist with the Division of Public Health and Community Services. Before we meet our guest today, I want to give you a little health update. Our COVID-19 community levels are pretty stable. You can see from 2 weeks ago, we had a lot of green in the map, and we continue to have a lot of green in the map 2 weeks later. This data is from March 10th. And you can also see that there's a little bit of stuff going on up in Maine with some higher levels transmission for them. And in addition, we can look closer at New Hampshire, and we have a very happy site here for our our community levels. And that is an entirely green New Hampshire map. So we have low community levels. Now, what does this mean? It doesn't mean there's no COVID. What it means is that our resources health-wise are not being overtapped. So when we look at community levels, we're looking at all the needs of the patients and the hospital beds and the ICUs. And right now in Hillsborough County and the entire state, we're at a very good place as far as healthcare responding to COVID-19. Just to give you a little contrast, the community transmission level looks a little different. So we have some high transmission levels in Hillsborough County. So that means it's still active and it's in the area. What that might mean too is that people are not getting as sick, or they're managing it better at home. So very important to remember that boosters are still available, and we have boosters available for those 6 months of age and up. And so please, if you have not been boosted, please get that shot soon. It lasts about 6 months, so we're trying to figure out when we'll go on to a normal cycle with the COVID-19 booster. If you have symptoms of COVID-19, please get a test. You can do the PCR test, or you can do the at-home antigen test. Public Health has a huge amount of these tests available for free for agencies and for anyone who might need one. So contact us at 589-4500, and we can hook you up with some of those tests. Again, those are free, and we do recommend, if you have any type of cold symptoms, to go and get tested so that we know what you're dealing with. And we also have Paxlovid available to treat COVID-19. So you can call 1-800-818-5803, and you can speak to a representative from On-Site Medical, and they can send that prescription to your home. And you use that service if you cannot get a hold of your primary care physician. So start with your own medical provider, and then know that there are resources for treatment, and Paxlovid is known to shorten the course of COVID-19. And finally, I just want to encourage everyone to skip the flu, but not the vaccine. Flu is still out there. It causes between 12 and 61,000 deaths a year, and healthy adults can infect people up to 7 days after becoming sick. Lots of missed work days because of flu, lots of missed school days, and lots of medical costs. So please, it's not too late to vaccinate. And now it is my pleasure to introduce our guest, James Wilkie. Welcome, James.
Thank you.
James comes to us from the CareGivers, which is a program of the Catholic Charities of New Hampshire. You're the executive director of CareGivers. So tell me a little bit about CareGivers.
I can start way back. We began in 1984. We were the result of the Robert Wood Johnson Foundation. Mm-hmm. We were given a grant to start a transportation program in New Hampshire, one of 20 recipients across the United States. Started out as one phone in a church basement. Mm-hmm. It went pretty good. It was put together with the help of Catholic Charities and several of the area organizations. About 10 years later, we combined with CareGivers of NASHU, became one entity. Catholic Charities, prior to that, had kind of given us a nudge, okay, you're established, go off on your own. Mm-hmm. 2008, we went from just doing transportation to starting what we call the Caring Cupboard. There was a phone call to a lady to let her know that the next day a gentleman would be taking her to her appointment to go grocery shopping, rather, and she said no, she couldn't go. She had just got her oil tank filled, and she had to make a choice about whether I pay for my oil or do I buy food. Mm. So the great minds at the time got together and decided we need to do something about this, and they started the Caring Cupboard. They sent out over 200 letters to people, and they got 40 people that initially said yes, they would take groceries, because it's a pride thing. You know, you don't want people to know that you're having problems. You
Sure.
just don't want to. So since 2008, it's continued to grow. We now support Manchester and Nashua and the 14 communities that touch them. We are also in the process of expanding into the Lakes region. For Manchester, Nashua specifically, we supply transportation services to medical appointments, to grocery store, pharmacy, chemo, dialysis, radiation treatments, pretty much anything the client needs. And in addition to that, we also give out the monthly food deliveries. We make reassurance phone calls to clients to say, hey, how you doing? We have some of our volunteers do that for us.
So I'm going to come back to that because, you're making these for clients, but it's mostly the elderly and the disabled, from what I understand.
We have a client base. You have to be over 62. And we are trying to service the most needy. So we have a threshold of 130% of the poverty level.
Oh, okay.
So that being said, a client making $1,500 a month is pushing it. And I stop and think about that. $1,500 is not a lot of money.
No, not when you have to pay rent and utilities.
How do you pay rent? Yeah.
Or mortgage or whatever it is.
So we're trying to help the most needy of the needy because our resources are limited, so we're trying to have the biggest impact. We do take people with disabilities under the age of 62 with a doctor-verified disability. So we're still trying to help anybody that needs the help. And you know, the reality of it is, if somebody calls me up and they do not have a car, they have a number of medical appointments, and they're making $1,600 a month, I'm not going to turn them away. We're going to help them where we can.
That'll be our little secret.
Yeah,
Yeah.
well.
Yeah, so, and then you're serving clients right now, and I'm going to talk about Nashua mostly because this is broadcast in Nashua, but it looks like for rides only, at least. I'm not sure about the Caring Cupboard piece of it, but Amherst, I actually have a lot of towns up here. Amherst, Hollis, Hudson, Litchfield, Merrimack, Milford, and Nashua.
Yes, that is correct.
So that's quite a big radius, actually, when you think about the surrounding towns of Greater Nashua, anyway. And then you're in Manchester, of course, you said, and you have Wolfboro here, so that's your expansion into
Yes,
the Lakes
Wolfboro,
region.
Alton area, yes.
Yeah, so that's, oh yeah, Alton is here too, and Goffstown, Candia. So you're busy.
All the time.
So we really appreciate you taking some time to speak to us about that. So, so the rides, like how easy is it to get a ride? Do I just call, or, you know, because a lot of these people that are in these situations too may not even have the resources. I was looking to online, for example, at your website. So, you know, if they don't have a computer, or, you know, how do they hook up with these rides, and then how does it take a long time for the income verification, or?
No, it is an application-based system because our clients have to be established clients with us. They give the phone call to the office. We mail them an application. They fill it out. They mail it back, and that can be approved pretty much that same day. Anytime, once we have that approval, we let them know that, hey, yes, you're part of the program now. We advise them on the steps they need to take to schedule an appointment, which is pretty basically they call the office. I have a wonderful staff answering the phones, and it's funny, I sit in my office and I can hear them on the phone, and I can hear one phone call go on for 20, 30 minutes, and I'm thinking, you know, we got to speed it along. We got more people wanting to call. But these people are also lonely and isolated, and that phone call may be the only person they talk to today.
Right. And so it's more than just a ride. You know, we should talk about that piece, because there is that isolation. And of course, coming out of a global pandemic, we all understand what isolation means.
Yes.
And there's no more isolation than for the elderly who can't leave their homes or might be living alone, those kind of things. So compounded with the pandemic, and what a great thing to have somebody come and pick you up and have a conversation with you.
Yes.
I think there's just such a benefit to that, that social interaction. It just, it's so important.
So to go on with that, once they call the office to make that appointment, we publish that appointment into a program that's accessible to our volunteers. And they go in there, they pick and choose what they have time for.
Oh, okay.
So there's no guarantee of the ride, but we are currently running between 94 and 98 fulfillment rate percentage.
Well, that's amazing.
Yes. So last year, we gave out over 4,300 one-way trips, and it was all filled by volunteers.
Now, it sounds like Uber to me.
There's
in
no
a
charge.
voice, you know, no, except for the charge. But you know, you put your ride in, you make the request, and if somebody can pick it up, they go.
Yes.
Although, you know, clearly, is there like do you need a lead time?
Yes, 10 days.
Oh, okay. So 10 days for every
Yes.
appointment. So you really have to be a little bit organized too.
Yes.
Do you sometimes help them book an appointment when they're dropped off, or, you know, for the next time, or, you know, I would imagine you take them to the doctor and then sometimes
The volunteer
home?
is only responsible to get them from their home to the position where
Okay.
they need to go, to wait for them while they're inside, and then to give them a ride back home.
Okay.
It's totally up to the client to schedule their own appointments or their
And
own
then they
schedule.
would just call
Yeah.
for their next appointment.
We ask them not to call the volunteer directly.
Right.
One of the highlights of our recruiting volunteers is they do this on their schedule. There's no pressure. I don't call them up and say, hey, you haven't taken a ride in 3 weeks. What's going on? It's totally up to them what they have time to do.
So, I mean, if you have a disabled individual that needs, do you need a different kind of vehicle, or is it?
We do not take wheelchair bound because our volunteers are
So
not
that's just
equipped to do
important for
that.
people to understand.
Yes. Volunteers typically don't have a wheelchair capable van or vehicle. We will take people that have walkers. We do ask that they be able to get in and out of a vehicle on their own. From a volunteer perspective, we don't want the volunteer worrying about somebody falling and they're going to get sued or something like that
Sure.
for something they had no control over.
Yeah.
So that is part of the vetting as far as being a client. You know, do you own a card? Is your income match? Are you in the right age group? Are you mobile? You know, a walker, a cane is fine because you
sure,
are mobile
absolutely.
with that. And I take rides myself from time to time just because I like to get out and talk to clients. I have a small pickup, and I am amazed. I always tell them, hey, I got a pickup. You okay with that? They'll grab onto that bar and pull themselves right on up in, you know, it's like.
Do you have the little standing bar at the bottom?
I have a step.
Whatever you call that. We have those on one of our cars, so that's the only reason I know about that. But yeah, so people just want to get out. They need to get to their appointments. So you're generally taking them to medical appointments. You're not taking them grocery shopping.
We'll take them to the grocery store and wait for them. I myself, when I've taken people to the grocery store, they'll, you know, I have to use the Mart cart. Do you mind coming in and walking with me? No, I don't mind. Get stuff down off the shelf, but that's going to be the call of the volunteer.
Sure, so that's optional.
Right. Yes.
Yeah, but what a great thing. Now, how old are your volunteers?
It's funny. I have, in addition to my rides and my grocery deliveries, I have people that come into the warehouse that are, you know, they're early 20s. All the way up. We have some volunteers that are older than the clients that they give rides to. So, you know, up into their 70s or pushing 80, one lady.
Yeah. Well, you're describing this, I was thinking of my own mother who would just she loves to drive.
Oh, have a
And
call. We'll set her
she
up.
lives in a different state. But I mean, this would be a great thing for her to pick someone up, give them a ride, and it would, you know, let her do that kind of service, which she's really into.
There is a side to volunteering. People are like, why should I volunteer? It's the personal bond you create with these clients. It's going home at the end of the day knowing that today I helped somebody. You know, I didn't help make a rich family richer or this or that. I actually helped somebody, and that's huge. And one of the things I always tell the volunteers, when you pick a person up and give them a ride to the doctor, and then you wait, and then you give them a ride back home, it sounds so simple. I said, but when you actually do it, you pick up that volunteer and you give them a ride, there's a little small talk on the way. Hey, how are you doing? Do you have kids? Are you married? Do you go to church? Things like that. They're going to this appointment. They're a little bit apprehensive because A 70, 80-year-old woman is not going to the doctor for physical. She has a concern. He has a concern, whatever the case is. They're worried about, I've got to see my doctor. And now they're going to get to that appointment. They don't have to reschedule it. 6 months to reschedule an appointment. Regardless of whether they get good news or bad news, they got to see their doctor. Now at least they know what really to worry about and what not to worry about. When you give them a ride home, they're going to talk your ear off. It's a whole lot different taking them home than it was taking them.
Right.
Only because now they have a peace.
Right. They're a little bit relieved.
Yes.
Like, oh, that was.
And that's when you realize how important it was that this meant the world to that client.
Well, speaking of that, I have a quote, and I know it's from your website, but I just thought it really spoke volumes about the services. So this is from an anonymous person. Having someone give me a ride to the doctor is life-changing. The Caring Rides volunteers not only provide me with the help I can't find elsewhere, they become my friends. Their compassion and kindness count so much when there are few people who truly understand us. So I thought that just spoke volumes of the important work. And it's, you know, it's a small service, but it's so huge. And if you're medically unwell, if you're stranded, it's just such a great thing. And I think if you can, what you're doing is, you know, you're pulling from these volunteers, like you said, when they can do it, so that maybe that's even getting you more people. Because, you know, okay, I can do that for an hour today or 2 hours or, you know, for that round trip. So how do I become a volunteer?
Call the office, we'll mail you, not mail you, we'll schedule you a time to come in. We do extensive background checks on all the volunteers. We do driving record, criminal record, through the Bureau of Elderly and Adult Services. So we go through this background checks, and unfortunately, they take a while. They can take 3 to 4 weeks going through the state because staffing issues at the state, no different than anywhere else.
Right, I understand. We use a lot of volunteers, and especially during COVID,
Yes.
we had to do the criminal background checks and all of that as well.
Once we get the criminal background check back, it's pretty much we give you access to our software so you can log in from home. We send you lots of emails telling you all the available appointments that you can just select right from the email what you want to do, and it registers right into our software system.
Nice. So how many volunteers do you have right now?
Oh gosh, if I was to look at all the different things we do,
Yeah.
we're pushing about 200 volunteers.
That's awesome. That's
Yeah.
incredible. So if you want to, so we talked about the rides essentially, and you did mention the caring. So what else can you volunteer to do if you're not a driver? You said you have some people that come into your warehouse. Is that the food warehouse? Or?
Yes. So we have a small warehouse in the back of the New Hampshire Food Bank where we pack all our orders to send out to our clients for grocery deliveries. Each client that's on the Care and Cover program gets 1 delivery a month. It's about 35 pounds of food. It's enough to last a week to a week and a half. It's not enough for a month, but it helps take the edge off.
Sure.
So those volunteers will come in and pack. Half our clients get a delivery the first Thursday of the month, and the other half get a delivery the third Thursday of the month. And we got about 360 clients on that program right now.
Wow.
94 of those are located in Nashua.
Okay.
We're looking to increase our presence in Nashua. That 94 is actually up 10% from last year. Our ride count in Nashua has increased, but that's off topic. So we have the warehouse packing those orders. We have people that come in and sort produce and pack produce and dairy products.
So they're getting some fresh food as well, not
Yes.
just cans.
Yes, we're fresh dairy from Blake's Creamery in Manchester. We buy it from them, and we get donations from Hannaford supermarkets, what we call Fresh Rescue. It's meat and produce and bread products. And we also get some meat and stuff from Food Bank.
Which you're located very close to.
Yeah,
full
I
disclosure.
open up a garage door and there's my order. We have people that come into our office and do data entry because we're very data driven. We have to be for our funders. We have people calling clients. Right now we're in the middle of our annual client survey. We call all 520 clients to ask them, are we helping you? You know, what can we do better for you? So we're in the middle of that. We have clients that come in and wrap Christmas presents, or volunteers come in and wrap Christmas presents at Christmas. Other volunteers take and deliver those presents. We have the volunteers that deliver the food. volunteers that are giving the rides. Yeah, it's always busy.
Yeah. And you're probably always looking for more volunteers.
The problem we run into is there's more need than there is resources. So, absolutely.
So that's a yes.
Yes. Always looking for volunteers.
Yeah, and you can just go on caregiversnh.org, and there's a
Yes.
lot of information on there. I believe you can contact even through the website to
You can.
get the volunteer process started. You know, and I think it's just a great opportunity for people, you know, that have some extra time. They're looking for something that's a really amazing service. I do have one more question about the food. Is that also 135% of poverty? or is-
130%, yes.
130, okay. So there are some qualifications for that as well.
Yeah.
So what else do you want to tell me? Any other pitches?
You know, volunteering, I can never get enough volunteers. But it's one of those things that if you decide this might be something for you and you're just really on the fence, it's a place you can sign up, go through the background check, it's painless, and then try it. And if you don't like it, you don't volunteer anymore. Because where it is on your schedule, and you have to click that accept button to say, yes, I want to take that ride. If you don't click it, nobody bothers you. Now, I would be lying if I said that we never call anybody, because in the case of an emergency, if we know that somebody has dialysis, has radiation for the next 15 days, and we have a ride or two we can't cover, we'll call somebody up and say, hey, are you available? They say no, we say thank you, and we call the next person. We're not doing our job if we don't try to fill that.
Right, because you said you can fill about 94 to 98% when you
Yes.
send those emails out, but then you still want to fill those other 2 to 4%.
Yeah, we want to be 100% if we can.
Especially like you said, dialysis, things that just, they're urgent,
important.
they can't wait.
Yeah.
So, and I would imagine once you start, if you give that ride and it's something with frequency, that may become a routine for that volunteer as well.
We have some volunteers, they can see up to 4 months into what we have into the schedule. They can see rides that are still 4 months out. We have several volunteers that like certain clients because they have established these relationships with them. So they'll go out and they'll look for that client every appointment they've got for the next 4 months, and they'll take every one of them.
Well, that's
Yeah.
great. I mean,
Yeah.
it does this, because that, like you said, it goes both ways. It's helping the client, but it's really satisfying for the volunteer.
It speaks volumes to that.
And, it reduces everybody's social isolation. And even when you were saying in the beginning that you had retired and went back to work to do
Yes.
this job, there are a lot of retirees out there that want something fulfilling to do.
Yes.
They do want to give back. They have the time to give back. So I would encourage people, if you have a good driving record, to get in touch with caregivers. I mean, what an amazing way to give back and to do something really worthwhile with your time. So thank you so much, James, for
my pleasure.
telling us about this. And I know you want to expand to Nashville, and we're really excited about that. So we will definitely put some more of your information out there and refer to you guys as a resource.
I appreciate
for people
that.
that we come across. And just to wrap up here, I wanted to mention that courage is knowing when to ask for help, and that if you are having some symptoms of depression, sadness, loneliness, isolation, discuss these with your primary care provider, first and foremost, and get into some help that you might need. Secondly, is your blood sugar over 100? Know your number, know your diabetes risk, and visit your provider. There's a theme here. We want people to get back to their primary care providers. And also that blood pressure check. Is it over 100, 120, over 80? Again, know your numbers. It's very important, folks, that we do some of our own monitoring. Know your risk and visit your provider. And also, you can visit our health clinic on 18 Mulberry Street. We have clinics on Tuesdays, Thursdays, and Fridays. On Tuesdays from 4 to 7, we have immunizations and lead testing. And on Fridays from 9 to 12, we have immunizations and lead testing. And on Thursday, we have our sexual wellness clinic. All of these clinics are by appointment, so call 589-4500 and press option 2. Again, thank you, James, for joining us.
Thank you.
And if you have any questions about caregivers, you can go to caregiversnh.org. And I hope you all have a healthy week, and we'll see you next time.